Oigano Agerono, and welcome to another episode of On the Record. I'm your host, Michael Stalk. In studio today, we have Dr. Jones from the Kateri Memorial Hospital Center. We're going to be talking more on the H1N1 virus and as well as influenza in general. There's been a lot of information in the community, in the paper, on the websites, handout material. The hospital's been giving out extensive amount of information, as well as a lot of the organizations in general. There's also influenza or a flu vaccination clinic that's going to be happening this weekend, actually, for 5 days or 6 days.
Correct. It's starting on Friday, November the 6th, and we'll be finishing on Tuesday, so it's a total of 5 days.
5 days. and each day at the beginning is defined for specific groups.
Correct.
I'd like to go into that a little more near the end, just to like put everything together, and because we're going to be going on, today is November 4th on Wednesday. Tomorrow the show will be coming on Thursday, and then the clinic starts on Friday. So it'll give us that. But in the meantime, I just like to, I guess, talk a little bit about what is H1N1.
Okay, so H1N1 is a de novo flu virus, and what that means, it's a flu virus, but it's a brand new flu virus, and because of that, it has the potential for a pandemic. And so there's a few criteria that are required to be considered a pandemic. One is to have a new virus. So what that means is that everyone on the planet is susceptible to being infected by this virus. Secondly, you need to have a virus that's easily transmittable from person to person, and there has to be demonstration of sustained transmission from person to person, which is what we experienced. And there has to be spreading of the virus over different World Health Organization. They have the world's divided into certain sectors and continents, and so when you have evidence that it's affected several continents, then we have a pandemic. And in the past, we were planning for a world pandemic in anticipation of a more deadly kind of virus. So we refer a lot to the Spanish flu in 1918. And so a lot of the preparation was in place. It was being developed in case of a pandemic with a very serious flu. This particular flu is similar to the seasonal flu virus, and so it wasn't quite sure at the beginning if they were going to consider it being a pandemic or not. But since it did meet the criteria, and because of the burden it was going to have, the impact it was going to have on our healthcare systems in different parts of the world, on the economy, it was decided to go ahead and call it a pandemic.
And surprising enough, a lot of people say it, and I've been saying it for months now since we've been covering this, is that our community has come such a long way over the years, and I guess there was insight that there was something going to come down the road, because everybody's been talking about it, and we do have a comprehensive plan that is there. I mean, some parts right now are being implemented, but like you said, looking at a large mortality rate, which knock on wood, right now it's not this flu.
Correct. So the nation, the national, at a Canadian level, at a provincial level, and on a local community level, people have been working on a pandemic plan. And Kahnawake has a pandemic preparedness plan that was already developed. I think it was 2006, 2007. And Sheila Arnold was she was one of the driving forces behind developing the plan, specifically to a health concern. And so we put that into place on April the 28th, April 29th. That's when the World Health Organization had raised the level of the pandemic to level 5. Until then, we were at a level 3. And then on June the 11th, we went to a level 6. And so we already had a lot of preparedness already in place, and we are getting a lot of information from the top down, meaning that a lot of guidelines, a lot of information is coming from for example, the Ministry of Health, Ministry of Civil Security, and Public Health, the public health departments. And those three ministries are working together, and they've been providing information with respect to the surveillance, in terms of the testing, in terms of medication, in terms of guidelines for treatment protocols, also in terms of follow-up and how to organize different communities, and then this mass immunization campaign. And so there's been a lot of information that has come out. I think they have a site called Pandemic Quebec, which is easily accessible through the computer. Fight flu through the public health department on a Canadian level is also another good resource. So there's lots and lots of information and guidelines for the common person, for schools, for work environments, for hospital centers, long-term care, and there's a lot of information that has been provided. And with certain recommendations in terms of conduct and things like that.
And we'll go a little bit more into that, but we're going to take a quick break.
Okay.
And we'll be back right after these messages.